Dear friends and colleagues, my name is Pat Turner, and I'm president of the World Veterinary Association. I'm coming to you on the occasion of the Royal Canin Veterinary Summit on World Veterinary Day, and I'd like to say a few words about the impact of the global COVID-19 pandemic on companion animal practice. We are living through an historic time of worldwide pandemics, dangerous climate shifts, and global economic peril that are shaking us to our very cores as veterinarians, challenging our humanity and threatening our way of living and working. We as humans have been through various pandemics in the past, but what makes COVID-19 so different is its rapid spread all around the world. It's affecting every veterinarian today in very similar ways, and there's not a veterinarian who's been left untouched by this pandemic. These past few months of dealing with the global coronavirus pandemic have shown us just how important it is to come together as veterinary professionals to share information amongst ourselves, to keep members resilient and safe and businesses solvent, to support our clients and ensure good care and well-being of all animals, to ensure that veterinarians are recognized as providers of essential services per the recent WVA OIE press statement that was released. And this is a really important statement, as it did help to confirm that veterinarians should be providing and their businesses should be designated as essential. And a number of activities were listed as part of this: national and regional veterinary regulatory and inspection services, preventative health measures such as vaccinations against diseases with public health risk, and veterinarians working to conduct priority research activities. When we think about how this is impacting companion animal practitioners, it is important to remember that there are essential services for companion animal practitioners during the COVID-19 pandemic, and that companion animal veterinary professionals can continue to work. What is important is that we, as a community, use our judgment to determine what is urgent versus those things that aren't urgent. We should be triaging and postponing all non-urgent care right now. So what would that be? Well, vaccinations for things like rabies are really important for public health, and those should continue. But other non-essential consultations such as routine nail clips, mid-year health clinics, neutering, that sort of thing, those can be postponed until a better time. It's really critical during this time that you protect yourself and your staff and maintain as much as possible a skeleton clinic in staff. All doors for your clinic should be closed during this time. In terms of how we operate our business practices and employment, it is important to clarify the client's health status as it relates to COVID-19 infection. And this, again, is just to help protect you and the people that you work with. Time and time again, as we are learning information about this virus, it has been emphasized to us that the most important things for protecting ourselves against this virus are hand hygiene, frequent washing of hands, and biosecurity, so cleaning of surfaces and things, as well as physical distancing measures. We should be wearing appropriate personal protective equipment when possible, and consider some novel things that you might want to be thinking about with your clients, such as offering curbside service, where the clients remain in the comfort of their car while a team member picks up the pets and brings them into the clinic for veterinary care. You might even consider a home valet service, where an individual might even pick up the pet from the client's house. Ensure your clinic has a web presence at this time. More than ever, it's really critical that we be communicating with our clients. And if you haven't already, you should be implementing online ordering and home delivery of various products and services to help ensure that the pets that are in your care maintain good health during this period. And of course, using cashless payment methods is really important so that, again, we're not sharing objects back and forth with our clients. What we have seen during this particular period with COVID-19 is the growth of telehealth within veterinary medicine. If clinics didn't have this capability previously, they are scrambling to get this in place now. And it's really an important means of maintaining contact and communications with clients. Opportunities to use video imaging have been really important, and it is a means of seeing the pet that you may be consulting about in addition to looking directly at your client. But it is important that clients understand the limitations of video conferencing and telemessaging. So we can start to deal with and attempt to diagnose certain things, but we can't do everything, and we still will have to do certain types of testing. And it's important to communicate this. Determine the fees that you will be charging for these calls in advance, and try to collect the payment up front before consultation begins. This will prevent clients from abusing this type of service potentially. What we have also seen in the last few months is that there can be a lot of privacy and security concerns with telehealth, and it's important to ensure that whatever service you're using has end-to-end encryption so that the provider maintains appropriate privacy for your discussions with your client. Of course, any of these discussions form part of the medical record for the animal, and you need to keep records of these discussions occurring. This is a very challenging time for veterinary students and interns, and this is influencing our practice. We can't have interns in and even vet students in our practices the way we may have had prior to COVID-19 occurring. And what we're seeing within vet students and some residents and early career professionals is a lot of despair. They're wondering whether they're going to be able to finish their program and what the rest of their training is going to be looking like. And the applied training is going to be suffering through this process because there's only so much you can learn online. And this will require a special focus afterwards and the support of the veterinary community to try to train these new early career professionals. It also is hampering our discussions and our learning and our growth as licensed professionals. We're unable to network in person where we learn a lot of information and make direct contacts, but I would encourage you all to take advantage of the many free, excellent quality webinars that have been available in the last few months. These are a great way to round out your own information and knowledge and help you keep up to date with the latest trends. Sometimes some of these seminars even offer a virtual chat option after the seminar so that you can talk directly with specialists. Now more than ever, it's important to make time to connect with our colleagues and remember that we're part of a much larger community. So what do we know about SARS CoV-2 infection in companion animals? Well, there's relatively limited information to date. We have a few case reports from several different countries involving cats and dogs, and there's been a couple of experimental trials to date as well. The information that we seem to be able to sift out of this so far is that dogs can become infected and they do mount an immune response to this virus, but it appears that they don't transmit the virus between dogs and to humans. Experimental studies have demonstrated that both ferrets and cats can become infected and they can transmit the virus to others of the same species. It's thought that this occurs in a similar way as humans are transmitting it to each other, and this is through airborne transmission. Despite this, there still is not a case report demonstrating transmission of the virus from a companion animal to a human. So as far as we know, this is not a route of infection that is likely to occur. Because of the SARS CoV-2 infections and the fear that clients may have about the potential for their pets to infect them with this virus and other pieces of misinformation, we're seeing new and emerging animal welfare issues in companion animals. We're seeing animals being abandoned in the streets. We have concerns about the care for animals when owners are sick or hospitalized and their animals are locked at home or locked outside. Who will look after them? And we need to encourage our clients to have a plan for caring for these animals to ensure that they aren't neglected. Unfortunately, with this economic crisis related to COVID-2 infection and closure of businesses, we know that many of our clients have been losing their jobs and their income, and this means that they have a reduced ability to pay for veterinary care. Some clients are even relinquishing their animals to shelters, and I've heard from practitioners that they are receiving increased euthanasia requests for their animals because they are unable to pay for veterinary bills. We've heard of other reports still of dermatitis and toxicosis occurring in dogs and cats as clients attempt to disinfect the skin and hair of the animals. And we've seen reduced care for community animals because of physical distancing and the fact that people are unable to go outside and care for some of these homeless animals that are dependent on feeding and other aspects from people in the community. So these are important and emerging animal welfare issues that we should be thinking about how to address as veterinary professionals. Communications are more important than ever with our clients. It's really important that your clinic provide up-to-date information to clients about the virus to help allay their fears and to reassure them. Pets should be included in the family's social distancing plan, and as much as possible, the pet should stay with the family while they're sheltering in place. When people are walking their dogs, they should stay away from dog parks, and they should keep their pets away from other people. And always a good practice, people should be practicing hand hygiene before and after touching pets, and pets should not be allowed to lick their faces. And we would also recommend that people keep their pets away from sick family members at this time. We know that mental well-being is a critical issue. Just before I finish, I do want to mention that today also marks World Veterinary Day, and our theme this year for World Veterinary Day is protecting the environment to protect animal and human health. In addition to this viral pandemic, it's also a time to demand action to minimize climate change. And the World Veterinary Association has recently created a draft position statement on the global climate emergency. The position statement indicates that veterinarians, in their role as advocates for animal health and welfare, have a responsibility to protect environmental health and demand action to minimize climate change. So I would also like you to be thinking of what we can do as a veterinary community to minimize the climate emergency. Just in summary for today, I want to recognize that within companion animal practice, this is a time of uncertainty for everyone. Veterinarians all around the world are experiencing these issues. You are not alone. I want to remind you to be kind to yourself and to extend that compassion to others. Keep up to date with news, but protect yourself and your family against the trauma of too much negative messaging. Be very careful during this time. Protect yourself and your staff. Use appropriate hand hygiene measures. Be cleaning surfaces as much as possible, and practice good biosecurity. Maintain and expand your client base by improving telehealth practices and communications. This is a new way of operating for many of us, but it's the way of the future. Be alert for animal welfare issues amongst your clients and within your community, and try to remember that these animals look to us for much of their needs. And finally, enhance your social connectedness. Let's try to support each other and collaborate, and we will get through this together. Thank you so much for your time today, and I wish you all a good day.